Welcome to the financial review and assessment of the Virginia League of Planned Parenthood. The league was founded in 1923 by Margaret Sanger, which established its primary mission to ensure that individuals and families have access to the freedom, information, and ability to make their own informed reproductive choices. Three recent and significant budget provisions have had substantial impact on the league. First is the reversal of Roe v. Wade, which makes the abortion a state's decision. The second is the loss of Title X, a federal grant program that was solely dedicated to providing family planning and preventative health services for low-income families. And the third is the One Big Beautiful Bill Act that defunds the league by prohibiting states' Medicaid programs to supply payments to health centers that provide abortions. Virginia has become the destination for out-of-state patients because it does not have an abortion ban. Virginia is also the leading state in securing abortion rights. The state legislation has protected women's and families' rights through this whole process. However, due to budget cuts, the league in the state of Virginia is at risk for losing 3 clinics in Richmond, Norfolk, and Virginia Beach.
Revenue and debt analysis for the league consists of the total revenue of $16,363,325, and this is due in part to the contributions and grants and the program and services. However, they still should show a positive increase of $432,867. The league also experienced a 5.4% increase in total revenue, which was driven by the growth in both contributions and program service revenue. Investment income also showed a modest improvement, reflecting a sound portfolio management. Some key insight and expense overview consists of the contributions and grants, which remains the largest service revenue at 53%, followed by program services at 44%, emphasizing the organization's continued reliance on philanthropic support. Total expenses decreased, however, by 5.6%, which demonstrate improved cost control. Salaries and benefits remain the largest expense category at $9.3 million, accounting for 58% of the total expenses, consistent with service-oriented nonprofit or operations. The league also demonstrated a strong financial recovery in 2023, moving from $1.36 million deficit in 2022 to a $432,000 surplus. Both contributions and program service revenue increased by over 5%, reflecting effective fundraising and service delivery strategies. Expense reductions also contributed to the positive turnaround. Although total assets slightly increased, liabilities grew by over $1 million, reducing net assets by approximately 5%. This suggests potential short-term borrowing or expanded obligations to fund operations. Continual monitoring of debt ratio is recommended to ensure sustainability.
We will now investigate and review the Virginia League of Planned Parenthood's budget planning process. With the recent provisions detailed in the One Big Beautiful Bill Act and various other factors that may affect the mission of the league, it is even more urgent now that the league evaluate the budget planning procedures. Overall findings suggest a financially healthy organization with publicly available financial information. The league prioritizes effective use of expenditures to support functions that directly support program services, whether While there is a lack of materials that explicitly mention a budget process, inferences can be drawn from the league's public documents that help develop a process that would be suitable for the league to use. There is a huge area of opportunity in the league's budget planning process. While thorough financial record keeping indicates that a thoughtful budget planning process exists, there is no formal budget plan posted publicly. To ensure an effective process, the proposed plan for the league will consider the organization's fiscal year and the federal government's budget calendar, which are on two different calendars and cycles, so that decision makers can adjust to federal fund allocation. This is especially important since the league has already seen a drastic decrease in federal funding support, and the One Big Beautiful Bill Act poses an additional threat. After 4 failed attempts to reach out to the league for backup of their budget process, a recommended process has been developed and will be presented here. We propose a 12-month budget plan and detail key stakeholders. Key stakeholders involved in the budget planning process and timeline include the board of directors, who approve the federal budget and ensure the use of funds is supporting the league's mission and vision. The executive director, who leads the direction of the process and presents it to the board. The CFO, who manages the budget timeline, forecasts revenue, and handles department requests. Program and department leads, who provide projects and requests for their department's funds. A development director, who forecasts performance of contributions and grants, and an advocacy and federal funding expert to support budget decisions and projects. The board of directors, CFO, and program leads will be assigned a dual role in the process to help support budget planning that is affected by the federal government fiscal calendar. Here is the proposed budget timeline that considers the league's fiscal year and the federal government's budget calendar. You'll see here that the timeline accounts for specific tasks that are focused on adjusting to and accounting for federal funding. For example, in May, there is a push to determine which programs should be contingent based on the federal funding approval that happens on October 1. In October, the CFO updates federal grant revenue and expenditure lines to actual confirmed funding. There is a huge benefit to having the league's budget planning process publicly available for display. The league's external auditing process is commendable. However, additional information about the budget timeline and contributors provides an opportunity for increased donor trust and organization transparency. Additionally, publicly listing the budget planning process with all of the stakeholders across the different departments allows the league to strengthen messaging that Planned Parenthood provides more than just abortion services. Public understanding of this will be especially helpful as funding threats imposed by the One Big Beautiful Bill Act will require the league to garner financial support. My recommendation is to consider the proposed budget process plan that aligns the league and the federal government's respective fiscal years and make it accessible to the public.
This slide explains that Virginia's family planning clinics depend on money from Medicaid and Title X, and that money is not stable. When laws change or money is frozen, clinics have to cut services or close. This hits low-income people, people of color, and rural communities the most, especially in places like Richmond, Hampton, Norfolk, and Virginia Beach. Here, we show who is left out and who is better served. Low-income women, people of color, Medicaid patients, and rural residents lose local clinics and must travel far, which is hard because of cost and transport. Meanwhile, insured middle-class people in the metro areas keep access to private OB-GYNs and OP clinics, and many undocumented or very poor people do not even appear in the data. This slide explains how to better serve the groups that have been left out. Bringing back sliding scale fees and working with churches and community groups can make care more affordable for communities of color and Medicaid users. Mobile clinics and telehealth, including medication abortion where it is legal, can reach rural areas, and better funding from local and state governments can raise service levels that are now below average. Here, we talk about how to make the money system stronger and more fair. Clinics should get money from many sources like private grants, donations, and local contracts that reward good outcomes such as fewer unplanned pregnancies. More money should go to high-need urban and rural clinics and community boards, plus clear reporting by race and location can help match budgets to real needs. This slide shows this slide shows the main money risks that clinics face. Federal and state funds like Medicaid and Title X are going down, while legal costs, changing demands, and related rules raise costs. If Planned Parenthood is cut out of Medicaid, 700 to 800 patients a month are at risk. So clinics need strong control and close financial monitoring to stay open. This last slide gives ideas for long-term fixes. An emergency fund could help clinics survive sudden funding cuts, and stronger state-level advocacy can protect legal rights and Medicaid money for reproductive care. Telehealth, mobile units, budgeting that includes community voices, and strong auditing can make services cheaper, fairer, and more stable over time. This is the end of our presentation. Thank you.